My name is Maria Franco, as Liz introduced me, and I am living with a mental health challenge. I decided to say that today. It's the first time I've shared that because I believe this is the greatest platform to get awareness, to increase acceptance, and all that we need in the community. I'm excited to be here today as a passionate advocate of mental health awareness and reduction of stigma, but also as a fierce advocate, like Liz said, of unconditional love. As a young mother, when I was pregnant, my brother began to experience some very strange and frightening symptoms. It was like a bomb hit my family. No one knew what was going on. Many outside the family had an opinion. It could be drugs, lack of faith, demonic possession, witchcraft, vitamins, lack of exercise, doesn't eat right, so and so and so on. Accompanying my brother through this the confusing, complex, and sterile world of medical health was one of the biggest challenges I had faced as a young person. After many years of this struggle, we got the diagnosis, but it really didn't answer any questions. Drug-induced schizophrenia. That word was so scary to myself and to my family. We now know what it was, but still had no idea how to move forward with it. Resources were scarce for the English-speaking community at that time. This was 20 years ago, but even more so for the Spanish-speaking community. My parents, who didn't speak the language and were immigrants in this country, had no idea how to deal with my brother. Still today, 20 years later, my brother still struggles with his illness. He's found a sense of peace as to finally found the care that he needed, but it took 20 years of suffering for that to happen. And then soon after, perhaps stress, perhaps hereditary, I began to experience strange symptoms. My heart was racing, my stomach was upset, I had chills going up and down my spine, and I had this fear of doom that I didn't know where it was coming from. I was soon diagnosed with GAD, generalized anxiety disorder. And although it wasn't as invasive and as controlling of my life as schizophrenia, it was still a very hard thing to deal with. And over the next 15 years, once again, I was navigating the complex, confusing, and sometimes overwhelming medical system. This condition created in me a deep desire to reach out and help others. I wanted to help others in my family, in my church, my community, and anybody that would share with me that they were struggling. Through my work in the church, I started to meet a lot of people that were struggling in one way or another, either themselves, a family member, a child, a friend, and I knew that there was a great need. After a parishioner who was unfortunately homeless at the time began to visit our parish, and she was obviously struggling with a mental health condition, our church decided to give all our employees mental health first aid training so that we would be better apt and better prepared to deal with people going through this and that were looking to the church for help, which is a very common thing in the church community. Once I took this class, I was inspired. I realized that everybody needed to take this class. And through my work at the church, I experienced more mental health crisis with families, with community members. And I began to think we need to offer this class to everybody who wants to take it. So through the collaboration with Quinn Center, Taller de Jose, and CSPL, we began the mental health first aid trainings that Liz talks about. They were so necessary and useful in the community. We were able to organize 3 trainings before the pandemic hit, 2 English and 1 Spanish. They were all greatly attended. We had to close the registrations so that we can have the limit amount of people attending and not overwhelm the facilitator. I remember our Spanish training was in February and a huge storm hit the night before, and the facilitator was not going to be able to make it possibly. After I asked her to please just wait till the morning and see how the streets were, to let me know then, because I knew how important it was. Thankfully, she was able to come, but our members that registered all showed up, over 40 people. The storm did not stop them. It was then that it reiterated to me that this is so necessary in our community. We hope to continue our work. Our work is not done. It's barely beginning. Through these great organizations that are here with us today, through Proviso Township, like Lorenzo said, and through many other organizations, churches, the schools, police departments, the mayors of these great communities, we need to come together and work to continue to bring awareness and reduce stigma. But I've also realized in my work that there's one more facet or many more facets that we haven't even touched. Mental health awareness and acceptance is becoming commonplace in conversations. But in reality, is it really being implemented in our everyday lives? In the workplace, are people struggling with mental health challenges really accepted? In the church, in the education system, in colleges, and in social gatherings? I believe that our work will not be done until the word crazy, nuts, psycho, or cuckoo are no longer accepted or used by anyone. I believe that our work will not be done until we reach a level of unconditional love and unconditional acceptance of our brothers and sisters suffering with a mental health challenge. And that is why I am here today, because it is very important for me that we continue to work not only to reach awareness and to reduce stigma, but to make sure that unconditional love and acceptance is being shown. When people are welcomed in the workplace, when the church is welcoming and is caring for people going through this struggle, because they are people going through a struggle, they are not their illness. We have to understand that. So unconditional love is critical, and unconditional acceptance. And honesty, when it is easy for them and for us to share our truth, although the illnesses are all different, that is then that we know that we've reached a great platform and that we can continue to move forward. When it's as easy sharing that you have a mental health challenge or live with a mental health challenge as it is sharing your favorite color or your favorite food, and not get met with skepticism or awe or even rejection, it is then that we know that we have done our part. Our work is still yet to come, but we can make this world a better place. We can make this world an unconditional place for people suffering and struggling with this very, very dark and complicated illnesses. And so I ask everybody here to join me in this fight by listening to the resources, using the resources, sharing the resources, and doing everything in your power to make sure that everybody is loved unconditionally. Thank you for listening today, and I look forward to working with you all in the next year or so or more to bring this to fruition. Thank you.